Between the Lines would like to thank Protection Strategies Incorporated for sponsoring tonight's program, one of our country's leading providers of integrated security services, including operational security, training, testing, and evaluation. Clients of PSI include the Department of Justice, the FBI, and the Department of Energy.
Ryan Spitzer, for Circuit Court Judge, is also sponsoring tonight's program. Ryan is a prosecutor and Army medic for 6 years and a lifetime Tennessean. A graduate of Vanderbilt Law School, Ryan is dedicated to serving the citizens of Anderson County.
Thanks for joining us tonight on Between the Lines. We've had 3 shows today, and we've covered everything from cybersecurity to Washington, but we're bringing it home to Anderson County today, and we're going to talk about COVID and look at the last year and what we went through, and look at what we're doing today and what we can expect in the future. So we're staying home. I have EMS Director Nathan Sweet, who's been the director since 2009 and spent 20 years working for the ambulance service here in Anderson County. I know him personally. I've worked with him. He does a great job. And we're going to talk to him a little bit today about COVID and everything we can expect and changes. We'll talk a little bit. He's limited in what he can talk about on some things, but he has a good feel for everything that's going on. Welcome.
Thank you. Thank you. I'm glad to be here.
I'm glad to have you here. Tell us about EMS in general before we start on COVID. How are you doing? How's everything going?
It's going good. It's going well. Unfortunately, our line of business, when we're busy, that means that there's a lot of calls to go on.
I know there's been some bad wrecks in the last few days.
There has been.
Yeah, 4 or 5 of them. It's summertime, everybody's out.
Yeah, summertime, everybody's out distracted, looking at the scenery, wishing they was on the lake, looking away from where their eyes should be on the road. And it's unfortunate, but it happens every year.
And I'll avoid confessions about what I do driving, and I'll just say I'm a lawful driver. I'll leave it at that. Tell me about the health of EMS. Tell me about the last, how many employees are there? How are you doing? How many stations do you have? Just give us, before we talk about COVID, just tell me a little bit about what's going on.
Absolutely. So we have 68 full-time staff.
Okay.
We cover all of Anderson County and part of Roane County, the Oak Ridge section of Roane County, the Blair section of Roane County. We cover that as well. We've got 6 substations that operate 24 hours a day, and then we have an additional 5 trucks that work during the day. Some are assigned to do convalescent calls. There's 7 of them that are assigned for the advanced life support, 911 emergency environment. So we, of course, operate 24/7, 365, and there to respond when we get the call.
Tell us where those 6 stations are.
Sure. We've got 1 in Rocky Top, 1 up in Clinton. We have 2 in Oak Ridge. We have 1 in Oliver Springs.
And the 2 in Oak Ridge.
And 1 in Andersonville, I'm sorry.
1 in Andersonville. I remember in the old days, back in 20 years ago, one of them was over next to the condos over there, right on the corner of in the back when you turn back.
Arcadia over there by Melton Lake.
That was one Oak Ridge, and the other one was in the Grove Center.
Yep.
Same locations.
Those are in the same locations. The one up in Rocky Top, right next to the police station, same location. Oliver Springs, we have a joint facility with the Oliver Springs Fire Department. There on the main road.
On the right, going down through Oliver Springs. And is there any differences between the stations? Anything you can tell? Anything changed in the last 5 years?
No, not really. There hasn't. We're actually getting ready to go through a station location study to make sure that our stations are in the right place, not only now and today, but we're seeing a lot of growth in Anderson County right now. What's the future hold, and what do we need to prepare for? So we are working on that to identify where our resources should be to maximize our response to the most citizens of Anderson.
You mean population growth, right?
Yep.
Expansion and stuff like that.
Yeah.
And a lot of growth in the north end of the county, Andersonville and those areas.
Yeah, Andersonville, Oak Ridge has had put up a lot of houses, apartment complexes. They're getting ready to finish one. They're talking about another apartment complex in Oak Ridge. I think Claxton area, Clinton's really starting to grow. Hollingsworth is putting in a park there in South Clinton.
Beautiful park, outstanding.
It's going to. I've been out there to see the development. It's going to be a big deal.
Joe does a wonderful job for the community. I don't think people realize how much Joe Hollingsworth puts into like the Clinton athletic facilities, the parks and things, and just employment. It just a lot for the community.
Yeah.
I really.
That park's a big project, and he's
huge.
funding it.
We had him on a couple years ago on a different show, and it was incredibly large. So you have 68 full-time employees. How are they broken down in stations? I mean, Station 1 have more than Station 6, that kind of thing?
So each station has a 24-hour truck, and then we have our day trucks that operate. And usually those trucks, the day trucks, will start out in one of the Oak Ridge stations, the one over there by Melton Lake, and the one in Clinton. Puts them on the north end and the south end, so that when they, for convalescent calls, they're kind of split in between different sections. So the 911 trucks, all of those are distributed equally throughout the county.
So you have, what's a day truck? One that runs just during the daylight?
They do. They do. They have
more activity
shifts.
During the day?
There's more activity during the day, but especially with the scheduled calls. People that need to go dialysis, doctor's office, they can't get there on their own. Those transport calls, those happen during the day, during the week. So we have those trucks staffed during those times to meet that need.
I see. And in a given day, how many homes, business, how many emergency responses would you have as an entire state?
We do about 32 emergency responses per day, 50 responses total per day.
And is the 18 transports or different kinds of responses?
Define
18, the 18.
Yeah, the 18 would be those scheduled calls, those dialysis.
Gotcha.
And of course that always fluctuates. Not every day is exactly that number, of course, but some days are higher than others.
When I call an ambulance, I call 911, I'm going to get an Anderson County ambulance in Oak Ridge. If I have scheduled dialysis, I have options, right? I could get a private transport or you guys?
If you start in Anderson County, it'll be us. If we can't meet the need, if we don't have the resources to get you where you need to get, then the opportunity to find someone else does exist.
Okay.
Yep.
Has there been changes for those viewers across Anderson County that have medical bills, and a lot of us have a lot of, has there been any changes in the way insurance bills through ambulance? What does an average person in Clinton or somewhere have to face if they don't have insurance or insurance? I know you have to speak generally and you can't speak specifically, but you get Medicare reimbursement was a big issue when I was in government.
Yeah, Medicare, Medicaid. You know, if you've got Medicare, Medicaid, especially Medicaid, you're not going to see a bill.
Yeah.
It's actually would be illegal for us to balance bill.
Because Medicaid's below the poverty line and they're protected.
Right.
Okay.
It's federal law.
Right.
Same for Medicare. They don't get a balanced bill. But if you have private insurance or no insurance, then you're going to get that bill, and then you're going to get the remaining of the bill as well.
Right.
Anderson County government does have the ability to apply for a hardship waiver. Right. So they can contact us. That actually is handled by the finance department. So it's separate from EMS. Me as a director, I can't write off any bill.
It's a different department, yeah.
It goes through finance, goes to the finance director. He's the one that manages those, and we do get some of those, and those are evaluated to see if the person qualifies, and if they do, then either they can get a discount or they can get it written off. It depends on how they qualify.
So you would call the courthouse if you have that issue with an ambulance bill. You would call the courthouse and talk to the budget department.
Well, it'd be better if you contact us, and our staff can actually send you the paperwork and can help facilitate it. But when the paperwork gets submitted, it gets submitted to the finance department.
I got you. Okay, I misunderstood.
They make the decision, but we help facilitate, get the information, so the finance department.
So if you got a bill you need help on, you need to call contact the
Yep.
ambulance department, or I'm old EMS, and get that worked out.
Yes,
and there may be some help there for you. You don't know. So you have 68 full-time employees.
Yes, sir.
And and break those down. Paramedics, technicians?
Yeah, so there's 3 different levels that you primarily see in EMS. You have emergency medical technician basic, you had advanced emergency medical technician, and then you have your paramedic.
Okay. And paramedic would be a third of the staff?
So paramedic of the 911 trucks, it's half.
Oh, okay.
So you have 1 paramedic and 1 EMT or advanced EMT on an ambulance when it comes to a 911 ambulance. On our convalescent, it's double EMT or advanced EMT.
If I get a 911 truck coming to my house, the equipment in that truck is going to be different than the equipment in a regular truck?
It will.
it's more prepared for the immediate emergencies.
It is.
Stuff.
You have your
Excellent.
cardiac monitors. You have more medications. You have, those are the main resources that are difference between your medic 911 trucks and your convalescent trucks.
Like responding to a wreck or something. You may have somebody that's on the, exactly. I exactly see that. So you have a Lake City office in Rocky Top.
Yeah.
Sorry, again, I'm old. They were the Lakers when I was in high school.
I still have to think about it too.
I always refer back to Lake City. So you have Lake City. Now the Andersonville growing area, you got a new station?
And we've been in that station, we've been in that location.
I know where it is. Yeah.
Since about 2008.
Up near the school, right?
It's actually up on First Quality Drive.
You know what I'm thinking of? Your fundraisers.
Yep.
I got it. Okay.
First Quality Drive back there, that industrial park back there.
Okay.
We're located back there. But we've been there since I think 07, 08.
Oh, okay.
My predecessor, Robert Byrd, is the one that got that station put into place and implemented and staffed, and we've been there ever since.
I saw him the other night in Morgan County. I hadn't seen Robert in like 8 or 10 years. It was great to see him, and he's still flying. He's in the flight. Is that what he does?
Well, he works for GMR, Global Medical Response. He's doing great things for that company.
Oh, yeah, I can imagine.
He's loving it. He's excited. He's on county commission for Morgan County.
He always had a little political in him.
Oh, more than a little, yeah.
He's a good guy, though. He did in a difficult transitional time. He really helped Anderson County a great deal. And you came in 20 years ago. You know how that was.
Yes, indeed.
What does the EMS need to be better? I think taxpayers as a whole want to fund ambulances. They want to fund police. They want to fund education. Some things they're not as excited about. But having some experience in government, these are necessary things.
They are.
If we could, is there anything we can do for EMS as citizens, or recommend that would be to our commissioners? I
think honestly, the biggest issue EMS locally, nationally, possibly even worldwide, is that the understanding of what EMS does. We haven't done a good job of explaining what EMS does, because a lot of people think of the old emergency shows where they were picking people up and rushing them off to the hospital so they could get to a doctor.
That's how I see it.
We're an mobile ER unit on the road, but we have less people. We intubate. We can do surgical crikes, where you see that on the TV shows.
Yeah, sure.
We can do chest tubes. We have all these advanced procedures that you're seeing doctors and nurses do in the hospital.
Paramedics
we can do in an ambulance.
Wow.
So our scope and capability has significantly increased over the last 60, 70 years when EMS started, really in 1950. In the 1950s is when EMS started. We have changed so much, and I think EMS, it's been a tough road for us to try and educate the public on what we do and what we provide, because there's a lot of people who really still think that you call, we're just getting you to
You're a taxi,
we're almost like a
and you're putting them,
taxi.
letting them breathe, you got a little oxygen and do things.
Yeah, but we do so much more. The medications, and we do it on what's called standing orders. We don't have to call a doctor to get permission. We have those already pre-written before we ever get to a patient's house, what we can do for you. If we identify that this is going on for you, we go ahead and give that procedure.
Pre-authorized, sure.
And we identify you're having a heart attack. We call the hospital and say, hey, this person's having a heart attack. They go ahead and activate the cath lab. And we usually don't even stop in the ER. We roll them right to the cath lab to where they can get the cardiologist.
You make that diagnosis.
We make that diagnosis. That's a tricky word, because they don't like to say that we can diagnose, but we really do diagnose.
Evaluation.
We really do diagnose. I'll step out there, but we really do diagnose what's going on with you to help the hospital before we ever get there to know what's coming, especially if it's bad.
So you're really doing triage. In a way, you're setting it
Absolutely.
up. So that's exciting.
Absolutely.
And hospitals, let's talk about it. You go anywhere else besides Methodist?
Absolutely.
What if you come to my house and I have a big note on my chest that says, "Don't take me to Methodist, take me to Park West" or something?
Yeah, we'll take you to Park
Children's
West.
Hospital.
Yep. We take you to Park West. Any of the Knoxville ones, Roan Medical, La Follette. Now we start getting outside of that, and it becomes a little bit of a stretch.
Any hospital in Knoxville.
Yeah, any hospital in Knoxville.
And if you make a diagnosis that I don't have time to get to Knoxville, you're going to take me to Methodist?
Well, a lot of it does depend. I've had those patients are adamant, I'm not going to Methodist, and we let them know, here's the possibility. I'll take you where you want to go. Here's the possibility. Now, if you aren't able to make your own choice, if you're not in your right mind, we'll take you to the most appropriate hospital. You know, for us, if you've got a high trauma, if you've got a lot of traumatic injury going on, Methodist is not where we're going to take you. We're going to take you to University of Tennessee. It's a level 1 trauma center, meaning that's the highest level. They can handle just about anything we can bring to them. They have all the resources. They have all the specialists there to treat it. If you're a pediatric, we typically want to take you to children's. Why? Because they specialize in children. Methodist is limited on those. Park West is limited. The Tenova facilities, they're all limited because it takes so much to do that, maintain that, to achieve that level. It's understandable.
That's great. I didn't know you could break that down and qualify that. Yeah, that's excellent.
We try to take you to the most appropriate facility. Now, if you choose to go somewhere else, we'll try to advise you. But if you still choose to do that, then we'll do it.
Okay. We're going to take a break, and then we'll come back and start talking about COVID and what happened last year and what's happening this year. So let's give our sponsors a chance here. Doug, thank you.
Hello, I'm District Attorney General Dave Clark. My fellow DAs and I successfully fought for new elder abuse laws and procedures that have police departments and agencies using improved tools to protect our seniors. Victims of elder abuse are often unable to recognize or report abuse themselves. They need your voice. If you suspect abuse, contact local law enforcement or adult protective services. Let's work together to protect our seniors.
Always ready, always there. Visit NationalGuard.com to find out more.
Ryan Spitzer has been a prosecutor in Anderson County since 2007, prosecuting more than 2,500 cases over the past decade. Ryan has been the Drug Task Force prosecutor for the past 7 years. Ryan donates time working with local nonprofits. A veteran, Ryan spent 6 years serving his country as an Army medic in the National Guard. Ryan is a family man who works hard every day to keep Anderson County families safe. Experience matters.
Since the moment you were born, I've made 1,000 wishes. Wishes for your future in a world that's changing fast. Do play and laugh. Do win and lose. Do it all with confidence, kindness, and strength. And always do your best to remember that no matter what you do in this life, what matters to me is that you keep doing.
What if one day you went to your secret hiding place and instead of what you came for, you found this? What would you do? The truth is, all drug use comes with risk. Before drugs take their toll on you and your family, know that there is help. You can quit. If you or someone you love is struggling with drug use, call 1-800-662-HELP for 24-hour free and confidential information and treatment referral, or go to samhsa.gov/knowtherisks.
Between the Lines would like to thank Protection Strategies Incorporated for sponsoring tonight's program, one of our country's leading providers of integrated security services, including operational security, training, testing, and evaluation. Clients of PSI include the Department of Justice, the FBI, and the Department of Energy.
Welcome back to Between the Lines. We're visiting with Nathan Sweet, EMS Director for Anderson County for the past 12 years. And now we're going to talk about the big subject, the 5 letters that we've lived with for 2 years, COVID, COVID. And we're going to ask some questions. Let me start with this. Nathan, when did y'all first embrace COVID? When did you know it was a problem? Congressman Fleischman talked about some epidemiologists met with him in Nebraska when he was out there on a trip to visit some places and for the government, and they sat down with him before it started and said, this is going to be bad, here it is, laid it out for him, and basically predicted the waste fairly accurately. There was no real dip. It just continued, kind of held, but they were very accurate, he said, and kind of led us on to what we're going to do. And they said, and then we'll go away in the summer of 2021. Pretty much has, after we got everybody. So tell me the first month or two, what happened?
So, of course, I'm not much of a big news guy, but of course you hear people talking about it, and they started talking about it early in 2020. I think probably about February is when we started maybe listening a little bit more. And then come March is really when things started shutting down, is where we really ramped up. Now, I'll give it a little background. Of course, we faced a pandemic, nothing on this level. It wasn't anything like this when the swine flu hit in 2009, 2010.
Yes, we did.
This wasn't the first time that we've talked about a pandemic, and EMS has talked about pandemics for years. We talked about in 2012, 2013, the avian flu scare. That was nasty. We had lots of meetings, state level meetings, discussions on that. Ebola. During the Obama administration, Ebola was talked about. So pandemics by nature weren't new to us. Seeing the level of response that we saw with this one was new and unique. So come March, we changed a lot of our practices, but then you start running into supply issues, you start running into education. Communication communication created most of the problems that we encountered. Communication at every level, really. The media and how they communicated this, the DC and how it was communicated on a broad spectrum. That created quite a bit of problems. Now, I'll tell you, for the months of April, May, and June, our call volume just significantly dropped. So when it was really picking up, our call volume dropped off because of the communication that was out there. If you're sick, stay home. That wasn't the right terminology. The right terminology was, if you're sick, get treatment, get care. So those people that were sick without COVID, sick with other things, they stayed home too. So what we saw a rebound effect come the fall of 2020. We actually started seeing more severe cases of other things because people that were sick didn't get the treatment they needed.
Example of other things?
Heart attacks, strokes. So people that were having hypertensive episodes, they just weren't feeling well, having more headaches. They didn't know it was maybe hypertension. So they didn't get, because they were told to stay home. And some people were scared if I went to the hospital, I'd get COVID, because that's where sick people go. So they didn't want to go to the hospital.
Interesting. Define COVID. I mean, all of us know a little bit about it. I know you're not a medical doctor per se, but you're around it 24/7. But as you understand it as a citizen and in your job, it's a virus.
It is.
We can say that. And it seems to me, after watching it for a year and a half, it seems to be, it goes in your body and it looks for weaknesses.
Yeah, and that's pretty much any virus.
Okay.
Any virus looks for that weakness, that window of opportunity. And it treats people differently. I've encountered people that are super healthy, that run a lot, eat well, that had a tough time with COVID. And then I've met people that are out of shape, overweight, and it was like a little cold to them. And it really didn't affect them.
That sounds like genetics.
It's a virus. So you have this, we saw this with other viruses, and I'm not comparing this to other viruses. Let me go ahead and say that.
I understand. That's a good
this isn't the flu. This is different than the flu. But the flu, you might have one family member get it and everybody get it, or one family member and nobody get it. COVID, actually, from my perspective, that's what I saw. One family member would get it, everyone could get it, or one family would get it and nobody else would get it. So it's, to me, not the genetic side, not the scientific side. From that, I saw it spread much like you would another virus. Now it was a new virus. Coronavirus itself was not new, but this strain from 2019 was a new strain of coronavirus, COVID, SARS-CoV 2019.
Interesting. So and the first COVID case, what was your role in the COVID crisis? Let me ask that. What was your role in EMS?
We were front lines on the 911 side. We were going to people's houses, so we really significantly increased how much safety equipment we wore, the masks, the face shields, gowns, those types of things. We picked up our game on that. We did our dispatch center, the E911 dispatch center is managed by the Sheriff's Department. They do a phenomenal job. They would pre-screen people when they called 911. They would ask them specific questions. Back then it was, where did you travel? What kind of symptoms do you have? And then they would give our medics an alert before we got there if it was positive COVID or not.
I got you.
And then we would we'd go in and we do an assessment. We really, it was a change for our staff. Things that they had not done before. So I really want to give kudos to the healthcare community out there. They really had to change what they did and have done for decades to meet the need, and they really stepped up. And it was not easy, but they stepped up to it.
I want to thank Mayor Terry Frank. The information that we got in this county, from statistics to other things, was just, no other county around here had that kind of information. We were very fortunate. She did an outstanding job.
She did.
And it's a tough job because, Oak Ridgers have one perspective of COVID, rural people have another, and it's different, and some people don't want to hear this and that. And yet she kind of stayed in the middle and got us important information on a timely basis, and the best she could with the state and feds and everything else and what she could do. But she was ahead of the curve, and I thought that helped. And Governor Lee, he gets a passing grade from me. I give him a B, B+. I don't know enough about the situation to give him an A or a C, but he was very out front, and then once he defined what the limitations were and what it was, I thought he was very pronounced and proactive and did good. So I give Tennessee high grades as a whole. I really do.
I think he definitely grew through it.
That's
I think
right.
Just about anyone had to grow through it. Mayor Frank, she was great.
Oh,
she was contacting me regularly. What do you need? What do you need help with? What supplies do you need? And she would help any way possible, people that she might knew, that we could find alternate resources to go and get the equipment. The finance department, purchasing department, Anderson County did a phenomenal job because we had to change up. Our normal vendors didn't have the supply. Why? Because they're the normal vendors for everyone. So when we had to find other vendors that had it, purchasing department, finance department, Robbie Holbrook there, they did a great job in working with us, communicating with us so we could get the resources that our medics needed to do the transports and the calls that we encountered.
Oh, I remember going to buy masks in the beginning at Home Depot or somewhere, a quality mask, and etc. And there was just none to be had. And all of a sudden, the $5 box was $35, and it was kind of like the toilet paper run. It was
what was that?
It was, and there were masks, and it was just, it was incredible. But I just feel like our governments were locked in on it, and they took it as a high priority.
Here locally, I think we responded really well. We really did.
Absolutely.
Masks, hand sanitizer, all that stuff.
And I think our kids go to the same schools. But I thought the school response was interesting because I thought school was the safest place for the kids to be. I didn't like the online home stuff.
No.
Because, and they had to make a decision. Let's be fair to them.
That's true.
And they had to protect teachers. Let's be fair. Until a vaccination came out, teachers were at risk. And I get that. But if masks work, and at least generally, I thought it may have been something they had to do, but I thought our kids and the dysfunction, the spreading of COVID was enabled by that a little bit. Is that a good word?
It's going to be a little tough. You're really, this is a two-edged sword. You're going to get cut no matter which way you go.
Right. That's right.
Now we're seeing such a wave, and we're going to feel this for years on the behavioral health side. We talked to people that knew on the pediatric or the under 18-year-old, people that were going for mental health help tripled during the COVID because they were not allowed to do the things. My daughter's in gymnastics, they were shut down. My son was in soccer, they were shut down. It was stay at home, don't go outside. We took a lot of walks as a family during that time. But they didn't have their regular outlets. They didn't have the school on a regular basis to socially interact, and that was tough. And I think we're going to pay for it. for a period of time. But
that's right. Maybe a whole generation, maybe.
Yeah, very.
But the situation comes down to, I have a little more experience on the criminal side in terms of analysis and statistics, and it's just the number of overdoses there. That's in your world,
man.
Hasn't it skyrocketed?
Well, here's an interesting fact. For probably the first 2 to 3 months after a stimulus check, our overdoses doubled, at least doubled. And some months almost tripled because of the stimulus check coming out.
So you have more money and you have more time.
Yeah, and you were depressed and all those other things factored in. But for us, we were fortunate in Anderson County. Our COVID numbers were never really, from my perspective, never really high. We saw a lot of COVID calls. We were seeing them daily. Now we hardly see them. Very low numbers right now. We are still taking measures and protocols in place. And healthcare will for a while, because now OSHA is coming out with, the Occupational Safety and Health Administration is coming out with new standards. So it's all those things are factoring in. To me, it was kind of surprising how many people didn't practice good hygiene. And maybe because I'm in the medical world and we wash our hands a lot, that was kind of the early on. And good hygiene, man, goes a long way, COVID or not. It's a thing we have to do.
And I think people that didn't practice good hygiene started doing it a little more. And I think there was less illness. I didn't see many colds, less than normal in the winter.
Right, no.
Everybody was so afraid of COVID that they basically created screens for all kinds of
We didn't have a flu
infections.
season. Our flu numbers were way down.
Right.
And it was unique. It was very unique, to see the impact it had on healthcare. But I think overall, Tennessee as a state responded very well.
I think so too. We're going to take another break and we'll be right back with Between the Lines.
Hello, I'm District Attorney General Dave Clark. My fellow DAs and I successfully fought for new elder abuse laws and procedures that have police departments and agencies using improved tools to protect our seniors. Victims of elder abuse are often unable to recognize or report abuse themselves. They need your voice. If you suspect abuse, contact local law enforcement or adult protective services. Let's work together to protect our seniors.
Cash in your gold now to get the most money. With gold at all-time highs, TK Wheeler Jewelers in Oak Ridge is paying top dollar for your gold, silver, platinum, diamonds, and coins. And TK Wheeler Jewelers pays cash. Broken chains, mismatched earrings, bracelets, rings, old school rings, gold charms, old watches, and even coin collections. TK Wheeler Jewelers in Oak Ridge, where you get the most money now for your old gold. So cash in now at TK Wheeler Jewelers, 422 South Illinois Avenue in Oak Ridge.
Always ready, always there. Visit NationalGuard.com to find out more.
Ryan Spitzer has been a prosecutor in Anderson County since 2007, prosecuting more than 2,500 cases over the past decade. Ryan has been the Drug Task Force prosecutor for the past 7 years. Ryan donates time working with local nonprofits. A veteran, Ryan spent 6 years serving his country as an Army medic in the National Guard. Ryan is a family man who works hard every day to keep Anderson County families safe. Experience matters.
At Roan Medical Center, we are committed to serving this community and providing the best possible care for our patients. We have 20 medical specialists on staff representing all areas of care in a clean and safe environment. You don't have to go out of town to receive excellence in outpatient services, so please don't delay. The care you deserve is right here, right now. For the moments of need, we are here for you.
Between the Lines would like to thank Protection Strategies Incorporated for sponsoring tonight's program, one of our country's leading providers of integrated security services, including operational security, training, testing, and evaluation. Clients of PSI include the Department of Justice, the FBI, and the Department of Energy.
Welcome back to Between the Lines. We're talking about COVID. We've talked a little bit about how it worked in flu season. Let's talk a little bit about just the shutdown and how that affected. You started in on that with the talking about how some people didn't want to go to the hospital and some people. Give me a curve of your numbers. Did you see, we started talking about overdoses in 2 months. Are there other types of diseases that have been impacted by the shutdown? Do you see more stuff?
Yeah, so, you're going to get those depressive type situations, behavioral health calls.
Domestic violence?
Domestic violence. You're going to see some of those. So we saw also a drop in motor vehicle accidents.
Of course.
Shut down. Nothing was open. People weren't on the road.
Well, there was a point when the governor's office was, I shouldn't say the governor, but the state of Tennessee Transportation was looking and think traffic's too high in this area and traffic's too high in this area. And I thought, wait a minute now. That gets a little big brother on me, but that's all right. That's all right.
Yeah, we saw, our injury side, we saw those decrease. So we were seeing probably a 25% reduction in call volume. Doctors' offices closed, so people that need to go to doctor's appointments, elective surgeries, we weren't transporting them there. So we saw, for a good 3 months, we saw the call volume drop. Then come August, it really started to ramp back up and more severe calls. But the shutdown had a big effect on that. People had all their stuff that they loved to do was closed. Mm-hmm. Restaurants were closed. I think that had a big impact on people, and I think it, like we've said already, and you've said, it's going to be something we're going to pay for a long time.
I'll put a plug in for Big Ed's. They've opened up their restaurant. You've had to order to go for months and months and months, but they have opened the dining room. And I went by there last Thursday night to get a pickup, and there was 40 people in line.
Yeah,
and then I
tried to.
The county fair this week has been incredible. I mean, there's been, I don't know how many people. I was there Tuesday night, and there was just massive numbers of people there. It was just incredible, and that's one of the off nights normally. So people want out. People want out.
We were created for relationships, and I think that's when you take that away, it just has all those side effects. And kudos to also to Big Ed's when it first shut down, and they shut down. They had a surplus of pizzas to get. To distribute. They gave us some for our medics and our EMTs, and we got those out to our ambulance crews. And so thank you, Big Ed's, for that generosity that they gave us. But overwhelming, I think Anderson County had a great response. The community just loved on us incredibly. And it was tough for our staff. So their personal life, they were shut down. Mm-hmm. Then they were coming to work and getting bombarded with all of this information. Watching the media that had a lot of negative information, and it scared our healthcare workers. It did. Mm-hmm. They came to work scared, and they ran.
What were the rules? We'll talk about in the last segment the rules going forward. But going back, all of a sudden you had to wear different equipment. You mentioned shields, but
it's all equipment we had on the truck for a long time, but we didn't have to use it, and so now we started having to use masks all the time. Respirators at times, face shields, gowns. And I heard a lot of. I had some interesting conversations with the physician at one point in time, and he was talking about how it's not that bad. I said, "Well, doctor, you got to take into effect. You're in a well air conditioned, well lit facility. We are out in the middle of the heat, in high humidity East Tennessee, wearing this stuff." It's hard. It's tough.
Do you think COVID was sensitive to temperature at all?
From what I saw, I don't think so.
I don't think so either. I thought so in the beginning. We thought when it got colder it would kill germs, but I don't think so.
I don't think it had any effect. I think they hit that one on the mark. It didn't have any effect. Heat, cold didn't really have any effect on it, on how it spread and went from person to person.
Just to go track back, how does COVID spread?
So it's droplet based.
Okay.
And droplets can be in any form. I mean, droplets spread through the areas you talk. So it's droplet based.
That's why we had the 6 foot, because droplets can't normally go 6 feet. I got
it. The science on that is all over the place, and that's the tough thing. This is so new. It's going to take science a while to really figure it out, because I'm still reading articles. We got the Delta variant that's out now, and I'm still reading articles we still don't completely understand this virus. And now
So
we don't
Delta
understand.
virus, just for our listeners or viewers, the variant it's adapting itself.
It's mutating.
It's mutating to try to win the war on our bodies. Is that a fair statement?
It's mutating in response to what it encounters. It goes into somebody's body and it gets manipulated in the body and it manipulates the body. So you're going to see that manipulation of a virus, and we've seen it.
And a virus is a bug. It's a living thing, right?
You see it with just about every virus. You see it mutate. That's why they talk about different flu strains. And, so again, this is a coronavirus, and it's mutating. So viruses mutate. That's why you have stuff like MRSA. It's a resistant, because it's built a resistance up to the treatments.
MRSA, you got anything for that acronym?
Yeah, as soon as I said that, I knew you were going to ask it. I don't remember, but there's one called VRE, vancomycin resistant. Yeah. So vancomycin is a medication. So that has become resistant to that medication. So
we have to switch. It's kind of like antibiotics. We've all had experience with, that antibiotic isn't working anymore. We're going to switch you to this antibiotic.
Yeah.
So it's the constant battle.
Yeah, it is a constant battle. It's learning, but you're going to see those mutations. It's something and so you're going to get these different variants and Delta, and there's other ones out there. They've seen different strains in South Africa, Australia, India, Europe, California. They've seen some strains there as well.
What's the highest level you remember active cases in AC getting to? Was it like 2 something? Or was it higher than that? I can't remember.
It was higher than that. There was again, to me relatively it was a low number. We've got 78,000 residents.
Right.
And I don't remember. I think we actually got close to, I think we got over 1,200.
Did you?
At one point in time.
Okay.
But again, of 78,000 people.
And as of yesterday, it was yesterday, it was really earlier in the week. Like on a Sunday or Monday, I got a call. We had 6 active cases in Anderson County.
I think yesterday was 8.
Yeah.
Yesterday or Monday, it was 8. So I mean, you're talking about those are the active cases that we know of.
And most of the active cases, I've heard all in Nashville, but that's a state number that got told to me privately. But everyone getting infected is non-vaccinated.
I don't think that's true.
Okay, well, that's what we want to know.
No, the vaccinated people are also getting. See, and that's the thing they talk about this vaccine shot. It doesn't prevent you from getting COVID. The target is to have less effects from COVID, so less hospitalizations, less severe cases. So you can still get COVID, and you can still transmit COVID if you've had the vaccine.
Let me take the pro-vaccine point, though. Why has the numbers dropped to 6 after the vaccines got distributed?
So honestly, I don't think I could tell you because I don't know.
There's obviously a cause and effect
it.
there, though. I mean, if the vaccines are being distributed properly and people are getting them and they're mingling, then if the vaccine wasn't working at all or not effectively, we would have still had high numbers.
Right. I would have to say it's hard for me to argue against that.
The math is pretty strong.
Yeah.
Three vaccines. We had the Pfizer, we had the Moderna, and then we had the Johnson & Johnson.
Yes, sir.
Some side effects on those. I mean, any vaccine, though, right?
Yep. Any vaccine.
Do we have a vaccine for Ebola or swine flu?
Yeah, swine flu we do. Actually, last year in 2020, swine flu was the dominant flu case. So it was the dominant.
Do we have any kind of death statistics even close to COVID from those?
No.
Nationwide?
No, we don't. No, we don't. I mean, when we had swine flu, I think that it was just over 12,000 that died from swine flu. And again, it's tough really to fully evaluate, and I'm not a researcher to really dive into all the materials
general
out
knowledge
there.
for the public, sure.
Yeah, so you're talking about there's a lot of comorbidities. So the people we saw that were 911 patients that were sick had a lot of other underlying health issues.
Everybody I talked to.
Yeah.
There were some examples, and my heart goes out to the Cofield community as we start the football season.
Yes.
I saw Coach Henry 5 days before they went to South Pittsburgh for the playoffs. Talked to him for a while. He actually gave me a shirt. We've tried. My wife is from there, and we try to support Cofield athletics. And he comes back and he's sick, and his brother gets sick. So actually, they lost coach, they lost the assistant head coach's brother, and they lost the mother, all in like a 4 or 5 month period, which is tragic. So I think it became real for a lot of people after that. A lot of us I mean, for me, it wasn't just maybe not. It was this is a serious problem.
It definitely had an impact.
Oh, yeah. No question for us anyway. For my family, it was horrible. And what a great family. And I wish them the best of luck this season. I hope they rebound and honor his memory. I don't know if I mean, we all know, we've all heard about herd mentality, which is if you get to a certain level of people that are vaccinated or reduced numbers of cases, it dies on its own. It's got nowhere to go. Is that effective?
So this is my understanding, and this is how I try to explain it to some people. The whole herd immunity concept is actually is really the idea of making the virus, quote unquote, normal. You know, now it's a normal virus. It's something that we've had exposure to. We're building our own immunity up to it. We're building our own antibodies up to it, to where years later, it doesn't have that big of an impact. We've built that herd immunity because we've become exposed to it. It's not new. Our bodies are responding and reacting because we've had that interaction before. It's like, you know, when I meet somebody for the first time, it might be a little awkward. It might be, you know, us having to learn a lot about each other. But as time goes on, we really become, you know, we can sometimes complete each other's sentences. We can because we come to know each other better.
Like that, sure.
So it to me, that herd immunity is a normal body response to something that we've encountered before.
But herd denotes quantity. It denotes a herd is a number. So it would be our population as a whole building up this immunity, as you call it, or this response. Yeah. Are we there? Have we developed it?
I don't think so. I don't think you get herd immunity in a short period of time. Okay. I think it takes a while to get there. Mm-hmm. What does that mean for COVID?
So when I run out, we got down to 6 cases. How did we go to 6 cases from 4 months ago having 140 or 150? How did we get down so quick?
Again, I haven't done the research on it. I know that people have talked about that they've changed the test parameters. That the parameters. So when you run a test, you can determine the sensitivity of that test. Mm-hmm. So when you start being too sensitive, it'll pick up fragments that you're carrying it, but you're not really sick. Right. So there's a lot more people getting tested back then as well. So did they change the parameters? What's the volume of people getting tested? If we increased the volume, would we start getting more positive cases, or did they lower the test parameters, therefore we're not getting as many positive cases? I haven't looked into that information, to be honest with you. But I think there's less people getting tested. That's part of it. I think that there is starting to develop some of that immunity. I think people are maybe less inclined to report it because everybody's dying to get back to getting back to a normal.
And 99% of the people are going to get through it. So, I mean, that's the question. We're going to take our last final break before we get the final segment in to talk about COVID testing and things to look forward to. We're going to talk about the future. What can we expect in regulations? Thank you.
Hello, I'm District Attorney General Dave Clark. My fellow DAs and I successfully fought for new elder abuse laws and procedures that have police departments and agencies using improved tools to protect our seniors. Victims of elder abuse are often unable to recognize or report abuse themselves. They need your voice. If you suspect abuse, contact local law enforcement or adult protective services. Let's work together to protect our seniors.
Cash in your gold now to get the most money. With gold at all-time highs, TK Wheeler Jewelers in Oak Ridge is paying top dollar for your gold, silver, platinum, diamonds, and coins. And TK Wheeler Jewelers pays cash. Broken chains, mismatched earrings, bracelets, rings, old school rings, gold charms, old watches, and even coin collections. TK Wheeler Jewelers in Oak Ridge, where you get the most money now for your old gold. So cash in now at TK Wheeler Jewelers, 422 South Illinois Avenue in Oak Ridge.
always ready, always there. Visit NationalGuard.com to find out more.
Ryan Spitzer has been a prosecutor in Anderson County since 2007, prosecuting more than 2,500 cases over the past decade. Ryan has been the Drug Task Force prosecutor for the past 7 years. Ryan donates time working with local nonprofits. A veteran, Ryan spent 6 years serving his country as an Army medic in the National Guard. Ryan is a family man who works hard every day to keep Anderson County families safe. Experience matters.
At Roan Medical Center, we are committed to serving this community and providing the best possible care for our patients. We have 20 medical specialists on staff representing all areas of care in a clean and safe environment. You don't have to go out of town to receive excellence in outpatient services, so please don't delay. The care you deserve is right here, right now. For the moments of need, we are here for you.
Between the Lines would like to thank Protection Strategies Incorporated for sponsoring tonight's program, one of our country's leading providers of integrated security services, including operational security, training, testing, and evaluation. Clients of PSI include the Department of Justice, the FBI, and the Department of Energy.
Welcome back to Between the Lines. We're going to take this last segment to see where we go forward with COVID, where we go forward with other diseases. Have our practices, have we learned how to prevent disease a little bit by better washing of the hands and better cleaning, and all of that has an impact on everything we do. So we're going to have Nathan talk a little bit about the rules and regulations that are coming down from federal government, state government, on how we do things and what we have to wear. Fortunately, we don't have to wear a mask anymore in most places. There's still some place. My work is a federal contractor, and they require you wear masks into the office out of safety reasons, you know, because they're a nationwide office. They have to make rules for everybody, and,
Sure.
and there are areas that are still vulnerable. What can we expect in the future over the next year or two?
Yeah, and really, I think for the community, you're just going to see, especially public places, you're going to see a lot more heavy emphasis on cleaning. You continue to see stuff at amusement parks.
Can you kill it when you clean?
Yeah, you
can't survive outside the body very long.
No, it can survive outside the body for a period of time, but when you start putting in cleaning measures and effective cleaning, regardless of COVID or any other germ, bacteria, or virus, you start having that increase on cleaning, it's going to cut down on all those things. It's going to make an impact. It's going to make a dent. I think you're going to see people, we saw a lot of the Walmarts and the Krogers do this curbside pickup. I think you're going to see a change there. I think you're going to see a lot more of that. You started seeing some fast food restaurants that didn't deliver now deliver. So I think you're going to see a big change on some of those aspects. On the healthcare side, the Occupational Safety and Health Administration, OSHA, came out with a new law, emergency temporary standard, at the beginning of this month. That's going to affect all of healthcare. Those people that are providing healthcare, working in a healthcare environment, are going to continue to have to wear masks. If you're not vaccinated as a healthcare worker, you're going to have to wear masks when you're around your coworkers. Vaccinated people, they say, do not have to wear the masks. If you're exposed, which I will say for Anderson County EMS, we did not have a single employee exposed to a patient from COVID. During the whole time, and even to this day, we have not had an exposure, what we categorize as exposure to patients, because they wore their equipment.
Let's talk about HIPAA regulations for a second. We have some people that are vaccinated, and we have some that are not vaccinated, especially in kids. Mm-hmm. I took the vaccination. My wife, I'm not comfortable with my 16-year-old being vaccinated. I don't know enough about it. I've seen too many side effects and stuff, and I'm not discouraging people. I think if you're comfortable with it, you should do it. Will there be rules and regulations that says this kid can't go to social studies if he's not vaccinated? I mean, have you heard anything? I know that's not your side of the coin.
I haven't heard anything.
Right.
The local school system here is not requiring it.
No. And Governor Lee has said you either open
Right.
fully, or you go online fully. There'll be no sharing this time. We're going back to school.
I think some people want it. There's been multiple hospitals, and one I know of in Texas, that required their staff to get the vaccine, and if they didn't, I think they had 180 or 150 employees that did not. They fired all of them.
Wow.
And they said, if you're not going to get the vaccine, then you're not going to work here. So some employers are taking that stance. Some employers are not. For me, I'm not a big vaccine person anyways.
Right.
I don't take the flu vaccine, and that's a choice that I've made.
Sure.
But I also practice really good hygiene and do the best that I can as well. But for me, you have to be educated. If I'm getting a shot, what am I getting? What am I putting in my body?
And they're guessing at this point.
And what is it going to do?
Not guessing, but they're still working on limited durations. They didn't test this for 10 years. They're having to get it out quick and rush. And what is a vaccine? It's really, my understanding growing up was that a vaccine, in 1977 I was in college and we came out with the flu vaccine. First one ever, half of us got sick, But, and I never took another vaccine. So the bottom line is that a vaccine is just shooting the disease, a derivative of the disease or something into your body, is it not?
Honestly, I haven't done enough research, but most vaccines, yes, have some, either it's a dead portion of the virus or a partial live portion of the virus. As far as I know, the Moderna and Pfizer are not that way. They're an mRNA to attack the spike protein. So there's definitely going to be a lot of changes, I think, that are going to come out from this. I think there's going to be not just in healthcare, but also in public and all kinds of
requirements.
And
You got new requirements coming from the federal government. And let's be fair to the people that are requiring this. It's not the same in Brooklyn that it is in Woodland. They have to administer strict guidelines sometimes for what they do. And you can't deny that vaccines have had an effect. At least statistically, I look at it and I say, look, we've got this many cases. We had this many cases several months after the vaccination. So what are the long-term effects of those vaccinations? That's a mystery. But short-term, they seem to have had some effect on us. I mean, that's my
It's tough to argue with that because of the numbers that you're seeing.
That's right.
I would say that, but also, again, in our area, we have been so blessed and fortunate that we did not see the big cases.
Yes.
We were not seeing what New York and LA and Detroit and some of these hot zones and stuff like that. Locally here, we didn't see that.
And we got better communication. I mean, I thought Mayor Frank, Governor Leonos, I thought the health departments, I thought they communicated well. Whether you agreed with them or disagreed with them, long lines, everybody complains about something. But I thought that we got communicated with very effectively as a community.
Yeah. And they still have the resources up. I go and check their website, and I look at the impact, the numbers. I look at the hospital numbers and available beds and ICUs and ventilators. The Tennessee Department of Health, they still have that information available, and they're still showing it.
Didn't they make a decision to update it less often instead of daily? It's weekly now or something? Yeah.
Well, no, it's daily, but not on the weekends.
Oh, that's
they
what
don't
it was.
update
They
on
drop
the weekends.
The weekends. You're
Weekends
exactly
and holidays, they still don't update it, but they go back on Monday or the next business day and they update it.
Is there training? Is COVID training still out there? Are people being, like, you get a new employee, walks in and he gets his paramedic, which requires a lot of training, folks. They go through a lot of work. Does he have to go through any specialized training for COVID?
No, not really. I mean, we do discuss it. We do talk about it. A lot of it was just familiarization, bringing the material back. I mean, there's so much we train on anyways, because all the other calls didn't stop. They didn't end. They didn't stop. They decreased some, but we still had the heart attacks. We still had the strokes. We still had the diabetic emergencies. We still had the car wrecks and other things like that as well. But the training is routine. We train on germs and bloodborne pathogens every year. So it's something that for us, we will continue to train on that. And for us, it'll be a great reference point. Now we'll be able to go back and, hey, you guys remember the year of 2020? Remember the COVID? Remember the pandemic?
Sure.
We'll be able to bring that up. It's fresher in our mind to continue what we learned as far as our measures go, to continue and implement that going forward.
I can't remember anything in American history. And I'm becoming a bigger percentage of it every year. I can't remember anything in American history that had so much public attention to it. I mean, it's just incredible.
Yeah, and I think part of that is just the way media is today.
That's
social media
platforms.
You get instantaneous access to opinions all the time, and people want to communicate about it. So I think that's a big part of it.
And
but I
part of our
agree.
problem is trust in media is so low.
It is.
doesn't matter whether you're on blue or red. Nobody trusts what's coming out.
No.
I mean, they just think it's all opinionated and subjective. And that makes it harder.
Yeah,
Because you
it
don't
does.
know what to believe and what not to believe sometimes.
Yeah. Yeah.
But I think we
agree.
were unified. I think you have to give President Trump credit for, getting it out in warp speed, and you have to give the other side credit for cooperating and getting everything done. And they're still, I think as a whole, the nation pulled together pretty well on it.
Yeah.
I really believe that. I mean, obviously we disagree on stimulus and some other things, but as far as COVID, I think people were worried and they worked together.
Living in an environment that you don't have disagreements makes you question a lot more. So you have to have disagreements, really, I think, to get to a more solid solution for the most people. You have to have disagreements.
Yeah. Well, it's a challenge, especially when you, and I want to thank Nathan for coming on today. I mean,
thank you.
That's a challenge. I mean, because the geographical, New River's different
Yeah.
than
yes,
Emory
it is.
Valley, and those people deserve medical care like everybody else and
Yes,
stuff.
they do.
So I want to thank you again. I want to thank everybody else in the government that's helped us, and we'll get through it.
Yes,
we
sir.
always do.
Thank you so much.
Thank you.